Now, South Africa's first responders are facing a mental health crisis. Shocking statistics show that one police officer dies by suicide every week, with 54 SAPS members taking their own lives in the past year alone. Experts warn that trauma, long hours, limited mental health support are pushing police, paramedics, doctors, and even firefighters to a breaking point. The South African Society of Psychiatrists says urgent action is needed to prevent losing those who protect and save the lives daily. Dr. Siki Mdletye from the South African Society of Psychiatrists does join us now for a little bit more. Doctor, thank you so much for the time. Really appreciate it. There are 52 weeks in a year. 54 police killing themselves by suicide in the last year. That is, it's stark. But won't you just detail for us what exactly is happening? What's key to these suicides?
Hi, Arabile, and hello to your viewers. It is really shocking and unfortunate that our first responders really do bear the brunt of this mental health crisis, and really at the bottom of it is the fact that the work that they do really is not your typical kind of day. The exposure, the chronic exposure to trauma, the chronic exposure to gruesome scenes almost on the daily in the kind of work that they do. Pair that with work hours that are not necessarily the friendliest, with scheduling of shifts that leaves the body incredibly tired. So you can imagine being incredibly tired, being exposed to gruesome scenes the whole time, having your own struggles within your personal life. It becomes really a recipe for disaster. And as a result, we do find that the prevalence of mental illnesses, this includes your mood disorders like depression, this includes, anxiety disorders, and particularly post-traumatic stress disorder. So these mental illnesses tend to be incredibly prevalent within the population, that special part of the population, which is first responders, your police officers, your ambulance drivers, and the like. And this is far in excess of what you find in the general population.
Yeah. I mean, Doc, at the same time, you then ask yourself, what mental health resources actually do exist within the South African Police Service to help police officers who themselves, according to some data, half the police personnel qualify for PTSD or depression.
Mm-hmm. So the resources, I think, is a very interesting one, because the South African Police Services do generally have employee assistance program, employee wellness program, or employee health workers. They call them different things, HW and the like. But the interesting, or the reason I call this interesting, is because with services or health and wellness services within the employer, some of these can be met with suspicion by the people who are meant to access these services, and the implication of that becomes the fact that the very workers that are supposed to access services through these employee wellness programs tend to shy away from using them with concerns about issues like confidentiality, about issues like a threat to career progression. When one is perceived to be weak, when one is perceived to be struggling emotionally or mentally, the perception can be that they are weak and therefore would not be able to withstand progression within the career to a job of higher responsibility. So all of these factors contribute to the fact that these services that are there, which actually in themselves are quite minuscule when you compare the population of the first responder workers to the services that are available, there is already a very low level of access to the services. But even the services that are there, their utilization tends to be compromised by these issues, and that then becomes quite problematic in terms of these members of the first responder population accessing the services.
Yeah, Doc, I mean, I'm actually just running out of time as well, so I'm going to press on a little bit with just these two questions, if I may, at the same time. There are around 620 or so wellness staff for over 187,000 South African police services members. One, how do we scale that support a little bit further? Is it a time for a few more wellness staff, or how exactly do we play that one out? And then two, you often then get deemed unfit for service if you have to go through something like psychiatric help or assistance in any way. How do we overcome that stigma of being seen that way?
The numbers you've mentioned are grossly inadequate, and scaling them, I think, would need to come from several different angles. For starters, I think accessing services outside of those employee health worker services would become important. So collaborations outside of the existing services, I think, are a very important resource to tap into. Off-site and outside of the service, when people access the service outside of the service, they have a bit more trust sometimes in that. And I think this is one form of collaboration that can work incredibly well and improve utilization. The other issue really, I think, becomes preventing, and prevention at the primary source. So this would look at things like the scheduling, the rotation of shifts, because not all work within the South African police services is exposed to gross levels of trauma. There are slightly lower, call it risk rotations, and rotating people such that the exposure to the trauma is minimized, and over time, at least one gets time to recover. I think also initiatives that seek to screen for the mental health challenges, would be very helpful, because then you would pick them up. Because whilst we say there are large numbers of the mental illnesses within the population, a lot of them go undiagnosed, and what's not diagnosed cannot be treated.
Yeah.
So I think services that seek to particularly upscale or upscale the screening can be helpful in that then you'd identify and quantify the program and the problem, and then direct people to help. But definitely, I think an initiative that would make use of services outside of the service within itself can be very helpful, whilst also healing the employee health workers within the service.
Yeah. So much to really talk about when it comes to this, especially the current framework under which we're seeing police having to really work under as well. So very interesting conversation, an important one as well. Doctor, appreciate the time. Thank you so much for joining us here on AM Report. Dr. Siki Mdletye, from the South African Society of Psychiatrists there, as we talk about the high suicide rate of police members in the country, 54 over the last 1 year period. A stark number.